Okay, so hi and welcome, and thank you for taking the time to do this. Could you introduce yourself?
Hi, yes. So my name is Matt. I'm a 22-year-old college student and an intern here at Buddies.
Okay, and how does the LGBT community relate to you?
I identify as gay personally myself. I've been gay for quite some time now, and yeah, I definitely have some friends that are in Bergen County that are gay as well. So
And lastly, um, the point of all this is I want to ask you from your professional and from your personal, how do you think the lack of having an LGBT center impacts you personally and the community? And what is your insight?
I can definitely speak on for community at least. My friends have been, had HIV scares and have had STD scares, and at least for a long time, I didn't know that there was any services in Bergen County for HIV testing besides Planned Parenthood. So we always used to just take a bus and a subway into the city and go to, I forget which exact clinic it was, but I think that it's really important for me and also my friends to know that there is a community here in Bergen County that you can get STD testing and not have to go into the city. And I think that that's really, really important. I also think it's just really powerful to know that you are represented here. I definitely don't see representation in Bergen County always of me. So I think this is a great step.
And what do you think is the impact um, from what you see? You don't have to go in detail, but what is the some of the impacts of not having an LGBT center for your generation?
I think the impact, at least for my generation, I know is, at least I can see with my friends, that I personally think there's a high risk of drug use and drug abuse because I think that we aren't necessarily taught the information about how dangerous meth and other substances that are so prevalent in our community is number one. I think also number two, it just increases the death because I don't really see that there's a viable option to get treatment for, meth use or substance abuse in a setting where it really caters to you that isn't just a straight white male. It's somebody who understands your sexuality, understands your ethnicity, and can work with you on these facets.
And so this is your platform, and this is what I'm doing for everyone. So, is there anything else you want to bring to light in context of an LGBT center? Any other issues or any information that you have?
I just want to say, just as a final note, that's just super important to me, at least. I think that it's very easy for us to have one sort of setting and just be like, okay, we got a little bit and that's it and we're done. But I think we see, at least from my point of view, that we're not done and that there's so many resources and so much more we need that we aren't getting. So I just hope that there is some change and more just support in Bergen County for us as a community.
Can you elaborate a little bit? Then what do you mean by just a little bit of setting, or just a little bit, and then we're done? Can I know
Sure.
what you mean, but could you make that a little clearer?
Sure. So I think that it's important to, I think, just be more visible. I think it's important to know more of the resources and know that there is help and that there is information out there. I just think personally that we don't see it. Number one, I think also when you live in Bergen County too, as wealthy as the county it is, I think that the resources aren't always publicized for us. But I also think as wealthy a county as it is, we are greatly undercutted. So I think that it would be important to have full range STD testing, HIV testing that's easier, no questions asked, substance abuse that's also easier, no questions asked, no, you know, like real plan, because I think it's very easy for people to get really kind of caught up and scared of how they're going to stop instead of just going through the process. And I just think that they're just point blank, as simple as it can be, is that there needs to be more, LGBTQ plus centered things in Bergen County, period.
Yeah, and part of the reason I'm doing this is, we heard the statistics that 20 to 40% of homeless youth is LGBT, right? And I'm looking at it as on a macros kind of scale. And I know you're in school and you're doing studying stuff like this. So in the macro sense, if you have 20 to 40% of a population at youth, starting at like 10, 11, 12, coming or being thrown out solely because they're LGBT. But when they present it at these shelters, they're being presented as like, oh, there's discipline, mental health, there's all this kind of stuff. But really, they're just being thrown away because, from the family's perspective, they don't want them. So if you at that point, they if they don't get the services they need at that point, it develops into mental health and addiction and stuff. And then the next step is your generation, where you see people who have lots of suicidal tendencies. You see people who are lots of addiction, but hard addictions where they just, I don't care. There's no other reason. You see, hopelessness and not being able to connect with all this kind of stuff. And it's like it's a progression. What I'm trying to show is there's a progression of this stuff. So could you speak to that?
I think I could definitely speak to the progression. I had a friend who was engaged in substance use, and he was sexually assaulted at a party. I don't exactly know what happened. And he went to go to an HIV clinic. I believe it was a Planned Parenthood. It might have been Hackensack. It was somewhere in Bergen County. And he personally felt like they were very, like, not understanding of what had happened to him because he didn't really want to give too many details, but he just said, like, it wasn't really a consensual encounter. And the woman kind of was like, almost like, "Oh, well, are you sure it wasn't consensual? Do you know for sure it was consensual? Like, are you," like, kind of almost as if he was on the fence of it being consensual. And I think that that for him must have been very hard. I know it was very hard because he talked to me about it. So I think, getting back to your question, it's just really, like, sad to see that we don't have anything. I think also too, getting back to what I said before, when you talk to these people that don't necessarily understand that, gap of, like, that progressive problem, it then sets up this, very dangerous spot that we're in, where we don't talk about, gay men raping each other. We don't talk about all these things. So that for me is just my one experience where, like, I know firsthand that that really just destroyed my friend, because I don't really think he ever felt comfortable really talking about that
Yeah,
ever again.
yeah, and I can definitely relate to that. I know I work with sexual assault, and you know people don't a lot of people, not everyone, but a lot of people don't understand how men can actually be victims. It's just not in their brains. And it's just always, and especially gay men, because gay men, we still have that stench of it was a mental illness and it was a sexual deviancy. So that's the extent a lot of times of people when they think about us. So of course you're engaging in wild sexual crazy stuff, right? And if the person is the provider is having that kind of thinking, and yet you have a person who is in the midst of trauma and they're coming for help, and the person that's the provider is sitting there and being antagonistic with saying, well, are you sure? That's doing more damage than anything. And that's the reality of our people when they're suffering in that way, all too often. So thank you for sharing that and bringing that up. That's
Thank you.
a poignant point. So before we finish, is there anything else that you want to talk about? Any other issues that might be in there? I mean, if you're done, we're done.
I just would like to just, I guess, first of all, thank you for your time. And also just really hope that there is just any more resources for just anything. I think that we were talking about that sexualization of men. I think it's really important for us to just kind of change our thinking about gay people. And I think that your idea with creating more services and just having gay people more in, the normalcy and just in your eye, and have it not be so fringe and be so sexual, I think that would just be really beneficial.
Thank you. And so, just to be clear, you understand that this recording is going to be made public at some point, and do you give consent to that?
Yes.
And also to understand that you can, at any given time, for any reason or no reason, say, I want to take it down, and I will do so
Yes.
within reasonable time.
Sounds good.
And and I plan to reach out to everyone before it is made public, so they can view it and say, give a final, final look and say, yeah, this is good or not. You know what I mean?
Yeah. Thank you so
Okay.
much. Appreciate
Yeah.
that.
Welcome. Thank you. So I'm going to end the recording now.
Thank you.